strabismic amblyopia, is always unilateral and is caused by active inhibition of visual input originating in the fovea of the deviating eye. This inhibition is elicited by overlap of the different foveal images transmitted to the visual centers from the retinas of the fixating eye and the deviating eye. Anisometropic amblyopia is caused by active inhibition of the fovea in one eye to eliminate superimposition of a focused and a defocused image originating from the fixation point. Visual deprivation amblyopia, Amblyopic Anopsia, occurs in children with congenital or traumatic cataracts, corneal opacities, blepharospasm, surgical lid closure, or unilateral complete ptosis. Amblyopic Anopsia may also be produced in the formerly fixating eye of an amblyopic patient after prolonged patching, occlusion amblyopia, or after prolonged unilateral atropinization. Organic amblyopia may exist in patients with organic loss of vision from structural anomalies of the ocular media, retina, or optic nerve. Amblyopia secondary to nystagmus. The effect of abnormal eye movements on visual threshold is significant in patients with nystagmus in its latent and manifest forms. Fixation preference can be detected by the presence of searching nystagmoid movements of the deviated eye when the fixating eye is covered. Fixation preference can also be detected by observing the length of time required for the fixating eye to resume fixation once the cover is removed. If this occurs after a few seconds and before the next blink, a strong fixation preference exists, and the deviated eye is probably amblyopic. From a practical clinical standpoint, a difference of 2 lines on the visual acuity chart is commonly used as a diagnostic criterion for amblyopia. The neutral density filters profoundly reduce vision in eyes with central retinal lesions and glaucoma, whereas the vision of eyes with amblyopia was not reduced by such filters. In patients with amblyopia, it is always of interest and importance to compare the vision obtained with visual acuity symbols presented in a row to that obtained with isolated symbols. Patients with amblyopia are capable of discriminating small visual acuity symbols when they are presented singly, but not when presented in a row. In many amblyopic eyes, visual acuity at near fixation has been found to be no better than at distance fixation. The behavior of accommodation in amblyopic eyes. There is reduced accommodative response in amblyopic eyes. There is improved functioning of the amblyopic eye in low luminances. This led to investigation of whether the fixation pattern underwent any changes in scotopic conditions. The fixation area of an amblyopic eye may change with changes in the direction of gaze, usually in the sense that inesotropes fixation becomes more eccentric in abduction and less eccentric in adduction. In eccentric fixation, the patient reports that he looks straight at the object imaged on the non-foveolar retinal area. In eccentric viewing, the patient reports that he is looking past the object that he is asked to fixate. Bilateral eccentric fixation may occur in patients without strabismus and with bilateral central scotomas caused by macular diseases. The size of the receptive fields in amblyopic eyes is determined by the use of the Hermann grid. In normal eyes, pupillomotor sensitivity is highest in the macular area, whereas in amblyopic eyes pupillomotor sensitivity is greater peripherally than centrally. Diagnosis of eccentric fixation could be detected by ophthalmoscopic observation by asking the patient to focus on the visual target. The reaction time was significantly longer when measured through the amblyopic eye than when measured through the normal eye. The reaction time is the time elapsed between the presentation of a sensory stimulus and an associated volitional response. The unsteadiness in fixation is vastly exaggerated in amblyopia. The increased tendency of amblyopic eyes to drift while fixating a stationary visual target was also recorded. It is also confirmed that, The pursuit movements in amblyopic eyes are irregular and jerky.